love this question. So a big part of food allergies is education, education, education. So I'll start from the LEAP study. So this was a study talking about the early introduction of solids at the age of 4 to 6 months. And this is something that we as family medicine, pediatrics, wherever you are within that primary care field or wherever you are within that interaction with children at a young age, we should really be talking about families introducing solids and really allergen foods at that month period, as long as they have some cues. So we say infants, if they're eyeballing food, if they have good neck control, things like that, then they're really ready for solids. But one of the other things we should be talking about is, what kind of solids. And we're seeing that there is a disparity in different communities and the conversations that are being had in with these different communities on introducing solids and high allergen foods. And if you have a disparity in who's introducing solids and high allergen foods at an early age, then you're also going to see a difference in who has these developing allergies over time. So one of the things I think about is that we should really have a standardized approach to educating and encouraging families to introduce solids at an early age. So that's something that personally I've tried to work on as a provider. We also know that within communities, when we talk about educational initiatives within schools, there's a difference between rural communities like where I am and urban or suburban communities and their school districts. And so one example of this would be that in some rural communities, we need more policy to encourage schools and really just structures within the community to carry food allergy action plans or EpiPens. So if somebody walks through the door, they accidentally eat something, is there something there to help them in case of an emergency until they can get somewhere like an ER? And so those are some of the things that I think about. Other things with next steps, I love to collaborate. And so as a primary care pediatrician, one of the things that I think about is partnering with like urgent cares and ERs and talking about how do we work together to create a safety net model where we're educating families no matter where they go for help. So it could be the ER, it could be the urgent care, it could be the clinic office. We should all have a part in counseling families around creating allergy action plans. And so if an example would be if a kid goes into the ER, they have an allergic reaction for the first time, we now know there's a high likelihood of that food allergy. What are they going to do after they leave the ER? And this is important because what if that family isn't someone who is established with a pediatrician or primary care provider? So they need to have a plan until they're able to get in with their primary care provider. And so even the ER, the urgent cares, can be a part of this as well. So collaboration is a huge part of this. And then also educating around what a food allergy looks like. So food allergies, there's a wide variation of what food allergies look like for people. Some people have mild symptoms, rash. Some people have more severe symptoms. We call this anaphylaxis, where there's 2 or more systems involved. And so if you have a food allergy, yes, there's going to be the immediate part of the food allergy that needs to be treated. But sometimes there's actually what we call a biphasic anaphylactic reaction, where you have that first exposure, you get treated, some time goes by, and then within 8 hours, you can actually see some more symptoms occur from that food allergy. And that can catch people off guard if they're not aware that that's a possibility. So education, 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 and really a part of counteracting these disparities is ensuring that everyone has adequate or equitable access to education and knowing how to prevent food allergies, how to treat food allergies, and where we go from there.